Afternoon to all. Myself, Dr. Nilofer Sheikh. I am Associate Professor and Gynec Consultant at JS Ayurved Mahavidyalay and PD Patel Ayurved Hospital, Nadyad, Gujarat, India. I did my postgraduate in Stri Rog Prasuti Tantra subject at ITRA, Gujarat Ayurved University, Jamnagar. And today I am going to deliver the topic that is UTI during pregnancy and Ayurveda. So for that, here I like to share my PowerPoint presentation in front of you. So the topic is a urinary tract infection, UTI during pregnancy and Ayurvedic approach. So as a urinary tract infection is the common bacterial infection in the woman, especially the prevalence of UTI is increased in cases of pregnancy. The woman who is very much active in sexual activity associated with stone disease or the diabetes. Pregnancy is a common cause of obstructive uropathy and severe renal infection are relatively common. Because they arise from pre-existing covert bacteriuria, experts are recommended screening and eradication of the silent infection as a routine prenatal practice. So during pregnancy, urine routine micro is the common investigation to find out the even asymptomatic cases of bacteriuria. So infection is common during the gestation, and these bacteria causes the infection which is originally reside in the rectal or the anal area, and from there they colonize the perineum, vaginal introitus, urethra, bladder, and eventually it progresses up to the kidney. In most cases, the ascending bacterial infection affects only the lower urinary tract. It means it will create the asymptomatic bacteriuria or the acute cystitis. But during pregnancy, as many as it is about 25 to 40% of this lower infection ascend to the upper tract, and it can cause the acute pyelonephritis also. In a condition of UTI, the urinary status is the main responsible factor for the development of the UTI. So during pregnancy, ureteral dilatation begins during the 7th week of the gestation and progresses until the term. So here dilated collecting system may hold up to the 200 ml of urine, and because of this urine status, it is an ideal reservoir for the UTI. Second thing, a decreased concentrating ability of the kidneys. It also causes the antibacterial activity of the urine to be diminished, and which lead the UTI. The glycosuria and the amino acid urea of pregnancy provide an ideal culture medium for the microorganisms, and it will create the urinary tract infection. Even there are some hormones which are responsible for the increased incidence of the urinary tract infection, and these are the estrogen and the progesterone. So estrogen helps the bacteria to adhere the mucosa of the bladder, and the progesterone is responsible for the diminished motility of the ureter. So that's why the status of the urine is occurred in the bladder, and ultimately it is responsible for the urinary tract infection. Now coming to symptoms of the urinary tract infection. So first, that is the burning sensation or the painful urination. There will be the increased frequency of the urination, cloudy and the foul smelling urine, suprapubic pain during and after the voiding. Occasional, there will be the hematuria, means blood present in the urine. Intense desire to pass more urine after the micturition due to spasm of the inflamed bladder wall. It means urgency of urination, and usually this condition is afebrile. It means there is no increase the temperature, body temperature. There is pyuria as well as bacteriuria. So these are the symptoms of the UTI. Now coming to the choice of drug. According to the modern science, antibiotic therapy or the antimicrobial therapy is indicated in cases of UTI. Specifically, the commonest drug which is used in this type of cases is the nitrofurantoin, 100 mg orally twice a day for 3 to 7 days. And other drugs like amoxicillin, cephalexin, these are also very useful in cases of UTI during pregnancy. Now coming to the Ayurvedic view of UTI during pregnancy, and it is termed as the Garbhini Mutrakricchra. So the vyutpatti of Mutrakricchra. So here the term Mutrakricchra is it is a combination of two words, Mutra and the Krich. Mutra means urine and the Krich means with a difficulty or with a pain. So according to the Acharyas, the vyutpatti of a Mutrakricchra is Mutrakrichamiti Mutrasya Kruchena Mahata Dukhena Pravruti. So the disease in which Mutra means urine is voided with much dukha. Dukha means discomfort or the pain. Then it is called as the Mutrakricchra. Now coming to the Nidanas or the causes of the Mutrakricchra. So Acharya Charak has described causative factors of Mutrakricchra in detail. And Shushruta and Vagbhat have not mentioned etiology of this disease, while Madhav and Bhavprakash have stated the etiological factors, but they are same which are mentioned in Charak Samhita. So according to Acharya Charak, the Nidan of Mutrakricchra are Vyayam, Tikshna Aushadam, Ruksha Madhya, Prasanga Nitya, Trutta Prishtayanat, Anupamas, Adyashanad, Ajenat, Mutrakriccham, Nunam Iha Asto. So there are 8 types of Mutrakricchra which are described by Acharya Charak. In a pregnancy, due to pressure of the fetus, there will be the Apanavayu Dushti, and it will result into the decreased local immunity. So in this stage, specifically during pregnancy, when a pregnant woman will have this kind of Nidan Sevan, then it will create the Mutrakricchra. So pregnancy helps in the causative factors in the manifestation of the Garbhini Mutrakricchra due to certain physiological changes during pregnancy, and the Nidanas of Charak are mentioned here, and which I am going to explain in detail. First Nidan is Ati Vyayam. So Ati Vyayam means excessive exercise. So during pregnancy, Ati Vyayam or excessive exercise is contraindicated. Otherwise it will create the UTI. So Ati Vyayam leads the vitiation of Vata and Pitta dosa, And during pregnancy, female are not able to do the excessive exercise. So when pregnant woman during pregnancy, uh, it will do the adverse effect on the general condition of the mother as well as fetus. So it has also been reported that exercise act upon the hypothalamo-pituitary mechanism and increase the secretion of antidiuretic hormone. Thus, it will reduce the urinary output. Moreover, exercise makes the urine more acidic due to the production of lactic acid. In addition, over-exercise may also result in hematuria, and that's why it is considered as the one of the causative factor of the Mutrakricchra. Second cause is Tikshna Aushadha, or we can say it is a drugs having sharp properties. So Tikshna means sharp or the acute, and Aushadha means drugs. Here, according to the Hamadri, Shodhane, Yasya Shodhane Shakti iti Tikshna. So Tikshna Guna having the Shodhana property. So hence the drugs who has the Shodhana property or the sharp property, if it is taken in excess amount, then it will cause the Mutrakricchra. Again, Tikshna Aushadha leads to Pitta Prakopa, and this Pitta with the influence of Vata may accumulate in the basti and may cause the Mutrakricchra. Third common cause of this Mutrakricchra is Ruksha Madhya Prayog, continuous use of rye alcohol in excess amount. So, according to the Ayurveda, excessive Madhyapan is responsible for the Ojakshaya. So, Ojakshaya again lead the decreased immunity of the body, and because of the lack of immunity, it tends to be various infections, especially urinary tract infection. And in Western medicine also, it has been reported that excessive taking of alcohol causes the dysuria associated with hematuria, and sometimes maturation syndrome. So that's why Ruksha Madhya Prayog or the excess amount of alcohol is contraindicated during pregnancy. Fourth common cause of Mutrakricchra is Anupamasya Sevan. So, eating the meat or eating the fish in excess of animals living in Anupadesha. Anupadesha is one of the three types of the habitat where Kapha dosh is predominant with Vata, and the meat animals living in the area, especially the fish, is a Maha Abhishandi, not easy to digest. So, this Maha Abhishandi Ahar is responsible for excessive Kleda in Dosha, Dhatu, Mala and Shrutas, and thus it gives the favorable condition in the body for the various diseases. Fifth cause is Adhyashan and the Ajina. Adhyashan means eating before the digestion of the previous meal, and the Ajina means the indigestion. So bad dietary habit like eating of food before the digestion of previous food or the indigestion are the causative factor of Mutrakricchra, because such type of dietetic habit will produce the arm in the body, and arm is responsible for the lower body resistance, or it will decrease the immunity of the body. So thus it makes the body more vulnerable for the several kind of the infection, including the UTI. Sixth cause is Mutranigraha. It means suppression of the urine urge. Nigrah means suppression. So this is one of the prime factor which is mentioned in the causes of the Mutrakricchra. Hence the person or the woman who is in habit of suppressing his urge for urination may ultimately suffer from the Mutrakricchra. Why? Because this Mutrakricchra will lead the apan dushti, and because of this apan dushti, it will create the Mutrakricchra. In a female in females, they have a tendency of this vyadhi, that separation of the urination due to some social factors. And during pregnancy, because changes in urinary tract, the uterus lies directly on top of the bladder. As the uterus grows, its increase the weight can block the drainage of the urine from the bladder. This stagnant urine likely becomes source of the infection. Seventh cause is abhikshata, means injury of the urinary tract. So as Acharya Kashyapa described, the root of Mutravaha Shrotas is Basti and Medra, means on injury, distension of bladder, obstruction of urine and the irritation of urethra occurs. Now the classification of Mutrakricchra. So there are 8 types of Mutrakricchra are described by various acharyas like Vataj, Pittaj, Kapaj, Sannipataj, Dvandvaj, Ashmarijanya, Sharkaraj, Purishaj, Sukraj, Raktaj and Abhigadaj. According to Acharya Charak, 8 type of Mutrakricchra are Vataj, Pittaj, Kafas, Sannipataj, Ashmarijanya, Sharkarajanya, Shukraj and the Raktaj. Coming to symptoms of the various types of Mutrakricchra. So in Vataj Mutrakricchra, the main symptom is Tivra Ruja, means pain. Specifically in Basti and Medra region, means lower pelvic region. Swa Alpam Mutra means the quantity of Mutra, urine, is decreased. Muhur means the frequency of urination is increased. So these are the symptoms of the Vataj Mutrakricchra. Second, Pittaj Mutrakricchra. So in a Pittaj Mutrakricchra, the color of Mutra, urine, is Pitta, means yellowish urine. Sometimes it can be associated with blood along with pain and burning in a Pittaj Mutrakricchra. So there will be the burning sensation during urination. It is the key factor, it is the key feature of the Pittaj Mutrakricchra. Kapaj Mutrakricchra, there is a Shot and Gurutva in the Basti and Linga, that is the lower part of the genital tract. There will be the Shot and the Gurutva. So these are the symptoms of the Kapaj Mutrakricchra. And in Sannipataj Mutrakricchra, the signs and symptoms of Vataj, Pittaj and Kapaj Mutrakricchra may appear all together and in this Mutrakricchra. According to the Kashyapa, the symptoms like Murcha, means syncope, Brahma, that is giddiness, Vilapa, delirium, and these are also associated with the Sannipataj Mutrakricchra. Raktaj Mutrakricchra, due to Kshatajanya or due to the traumatic injury or Shatakshaya, this vitiated Rakta after entering the Basti expels out with the Mutra like Ashmari with Tivra Arti. There will be severe pain. That is termed as the Raktaj Mutrakricchra. When Rakta accumulate in the Basti, then it causes the Adman and the heaviness in the abdomen. Sixth one is a Shukraj Mutrakricchra. In this dysuria, which occurs in a man only. So here I am not going to explain it is in detail. The seventh and eighth type of Mutrakricchra are Ashmarij and Sharkarajanya. So in this condition, patient passes urine mixed with blood if there is ulceration due to the movement of stone. And when the stone passes down, patient passes urine easily. This stone, when broken up by Vata, forms a sand-like structure. It means a Sharkara. Then it is termed as the Sharkaraj-janya Mutrakricchra. Coming to Samprapti. So, Charak has described the specific pathogenesis of Mutrakricchra, while Shushrut and Vagbhat have mentioned the pathogenesis of Basti Roga in a general. So, according to Acharya Sushruta, the Basti Roga mentions in specific role of Vata in ether. According to the Sushruta, in the same way as the Mutra enters the Basti, the vitiated dosa also get their way into the produces its various disorders. Furthermore, he states that Samyak Vata is the factor responsible for the proper formation and excretion of the urine, and if this Vata gets pratiloma, means the direction of Vata is upwards, then it produces many Basti Roga like a Mutra Dosha, Mutra Gata, Prameha and Shukra Dosha. So ultimately the Pratiloma Gati of Vata is responsible for the development of the Mutrakricchra. The Samprapti Gataka, the involved dosha are three doshas, specifically Vata according to Shishrut, and according to the Kashyapa, Pitta is the involved dosha in condition of Mutrakricchra. Dushya, Mutra, Rasa, Rakta, Kled and Sveda are the Dushya. Udbhav Sthan is Pakvashaya, Adi Sthan is Mutrashaya, Shrotas is Mutravaha and Rasvaha Shrotas which are involved in this condition. Sang and Vimar Gaman is a Sroto Dushti Prakara. The Rog mark is Madhyam. Agni, here Agni Mandya is found. Vyadhi Prakar, there are two types of Prakara, Niche and Agantush can be associated with Mutrakricchra, and the Pratyatma Lakshan is Krichham Mutra Pravrutti. It means painful urination is the cardinal feature of this Mutrakricchra. So coming to Chikitsa of Mutrakricchra. In a Mutrakricchra, there is apavritti of Mutra and the pratilom of Apanavayu is there. Hence the Chikitsa should be such, it is Mutra Virechaniya. So the drugs helps in expulsion of the urine and pacifies the doshas. The Chikitsa of Mutrakricchra can be divided into Shodhan and Shamana Chikitsa. The common line of treatment of Mutrakricchra is Shodhan and Shaman. But again, Shodhan therapy is not indicated in a Garbhavastha. That means pregnancy. During pregnancy, we can't offer the Shodhana treatment. So only Shaman therapy is indicated in Garbhini Mutrakricchra. In Vatash Mutrakricchra, external application like Abhyang, Svedan, Upnaha, Parishek, Avgaha. Antaha Prarimarjan Chikitsa, that means oral medicines like Sthiradi Gan Aushadhi, Amritadi Kwatha, Valli Panchmul Kwatha are indicated. In a Pittash Mutrakricchra, again Parishek, Avgahan with cold water, Pralepa with Chandan can be used as an external application. Antaha Parimarjan means oral medicines like Shatavaryadi Kwat, Ritakyadi Kwat, Ikshuras, Siddhakrit with milk are indicated. Kaphaja Mutrakricchra, here the external application of the drugs which have the Tikshna properties. Again, we can't offer any external application during pregnancy. So just we have to give some oral medicaments to treat this kind of condition. In a oral medicine, Vyoshadi Churna, Shukshmaila Churna, Praval Churna with Tandulodak is indicated. In a Sannipatash Mutrakricchra, the specific line of treatment to treat the Sannipata Mutrakricchra is according to the Vatasthana. Again, Antah Parimarshan Chikitsa. In a Shodhana Chikitsa, when the cough is dominant, then Vaman is indicated. If a Pitta is dominant, then first Virechana is indicated. And for the Vata dosha, Basti is indicated. But during pregnancy, we can't perform any kind of Panchkarma therapy on the patient. In a Saman Chikitsa, Gandhakati Yoga, Trihatyadi Kwatha, etc. can be given. In a Shataj Mutrakricchra, as the Chikitsa of Shataj Mutrakricchra is similar to Vataj Mutrakricchra. And here the Chikitsa of Shukraj, Ashmarij and Sarkaraj Mutrakricchra are also explained by the Acharyas. But as here the topic is the Garbhini Mutrakricchra, here I don't like to explain these things in detail. And during pregnancy, again we can't perform any kind of Shodhan Chikitsa or the Bahid Parimarshan Chikitsa in specifically Garbhini Mutrakricchra. So, what is the line of treatment of Mutra Rogi in pregnancy? So the reference is from Kashyapa Khilsthana in Antarvatni Chikitsa Adhyay. In this Adhyay, the Acharyas explain that the physician should give for the drinking the decoction or the juice or the paste or the medicated milk of the drugs like Shatavari, Asparagus racemosus, root of darba, Maduka, Visresia glabra, Pashanbed, Usheer and the fruits of Kathak. So these drugs are safe during pregnancy and we can advise these drugs in cases of Mutrakricchra or UTI during pregnancy. Is there any research related to the topic? Yes, there are there are three research works. One is at Pune and the second two are other two were carried out at ITRA Jamnagar, and in these the research was carried out with the Brihat Dhatriyadi Ganvati and the Shatavari Ganvati, specifically in cases of urinary tract infection during pregnancy. So thank you so much for patiently listening.